Welcome back to you in our audience. We're thrilled to have experts here to talk about leveraging data analytics for population health. I am so excited. We have Dr. Anshu Abbat from LA Health Services and Sai Wodela from LA Plan, LA Plan, LA Healthcare. I'm sorry. Anyway, so thank you both so much. Before we begin, I'm just going to have each of you briefly introduce your self and your organization. Dr. Abbat, why don't you go ahead?
Hi, my name is Anshu Abbat. I'm the Director of Patient Engagement at LA Health Services, and I'm also a primary care physician internist at Harbor UCLA. In patient engagement, we're really focusing on how to engage vulnerable populations in their care and well-being. Some of those are through digital tools and also through other mechanisms. And we've made a lot of progress in the last 18 months, so we're excited about that.
Wonderful. Sai, please go ahead and introduce yourself. And I think I stumbled twice, so correct me.
No worries, Mark. Hello, everyone. My name is Sai Wodela. I'm a manager of health information technology here at Health Plan. In my role, I am responsible for overseeing operations and strategy of our health and health information ecosystem. Our ecosystem has 3 HREs, and we support a lot of initiatives across the enterprise, including quality improvement, population health initiatives like HEDIS, case management for high-risk population, and a lot of projects focused on practice information.
Wonderful, wonderful. So we're going to try to talk about how we move forward in this incredibly important area. One of the things that, and I'll try to start on an up note here. It seems to me, in my team's reporting over the last year or so, that population health management has been moving forward. Perhaps it's because of the strong realization coming out of this ongoing pandemic that we really need to leverage data better, and that we really need to move forward and look at all of our populations and improve their health and health status. So it seems as though we're making some real progress. Certainly in Southern California, a lot of progress is being made. What does the landscape look like to both of you around really moving forward to leverage data to improve population health management at this broad communities level? Dr. Abbat.
Yeah, I think that, a lot of our approach in this last 18 months in the pandemic that we're living in has been a population health approach because, initially we were doing a lot of work around messaging patients around COVID and then COVID vaccination, and now getting back into normal care and keeping people, healthy and well. And in order to do that, we actually had to build some tools, analytics, data, outreach lists, things like that, that we had in some capacity before, but we really needed to make them more robust and usable to do wide scale outreach to patients. And for LA Health Services, we have a patient population of about 500,000 patients here in Los Angeles. And so to really get scale, to make sure we're in good communication with patients, we had to not only have the information about our patients, but really make sure that we could contact them. So what we have done in leveraging that information over the last year is we're building first more robust practices around patient communication and engagement. But we're also using more tools like email and text messages and such for initially COVID communication, but now a lot of our quality outreach that we're doing to ensure our diabetics are staying healthy and that they're getting their labs done and that they're well plugged into care. So we've really had to build those tools and pretty robustly, and need even more and better data that we can use in the future.
Yeah, and Sai, your organization is care managing at LA Care Health Plan, many of the same people who are patients of Dr. Abbat's. It's a lot of the same overlap population. Share your thoughts in addition.
As a health plan, we cater to 2.2, I would say, I think it's 2.4 now, 2.4 million members. I would say a quarter of the LA County health population, and Los Angeles DHS is one of our biggest partners overseeing our members. I would say in general, health systems across the United States, I would say in the last decade, have started realizing the importance of having data and leveraging data to drive health outcomes, especially in the area of population health. At Healthcare Health Plan, we have a lot of functional areas where we use data, especially for case management for high risk. Yeah, we identify using data. We identify high risk population, and what we do is we do follow up care. Our case managers do follow up care, get timely care once they get discharged from a hospital. And we use data to identify members, and if they of certain age groups, if they need flu shots, if they need colonoscopies, we use data across the board. And I would say, data analysis is critical as a health plan for us to, accomplish a lot of these goals. And as a health plan and a health system, we are gradually shifting away from, fee for service to a pay for performance model, a value-based model, and data becomes critical to achieve those goals.
Yeah, absolutely. Now, let me ask you both. You are caring for populations that are both underserved and that have a lot of challenges, SDOH and other challenges. What are the biggest challenges in terms of making sure you have the right data and that you're leveraging that data properly for these populations? You've all got Medi-Cal, which in other states is called Medicaid, and some uninsured as well. So these are populations that are often living in situations of a lack of stability. And so getting the right data, making sure we're talking about the right people, identifying them correctly can be a challenge. What are some of the challenges you're facing and overcoming? Dr. Abad?
Yeah, I think that, and it's great because we have this intersection between our patients as the health system and work a lot with LA Care as a health plan. But we struggle sometimes with that first round of contact information that comes in from the Medi-Cal applications. And that actually can make it pretty challenging to even do that first touch or outreach. And I think that a lot of systems that care for Medicaid or Medi-Cal patients struggle with this, that there are a percentage of patients that are not active. And so we are outreaching to patients and trying to get them engaged in care, but maybe we don't have the best phone number to be able to contact, or email. We don't have an email address for the most part. And the address that we may have, it depends on how that patient initially filled out their form. So that can be an initial challenge as we're really trying to do this more, total population approach. I think we struggle sometimes with just the contact information itself and that being accurate.
Yeah, Sai?
Dr. Abad brought a good point about phone numbers, having right addresses for these patients. These are the struggles that we hear from our providers, and these are the same struggles that our case managers. I would say that's one of our biggest challenges as well. And to overcome these challenges, that's why we have health information ecosystem, the HIEs, which play a critical role in getting us the real-time information. Let's say any of these members go to a hospital. If you're not connected to the hospital, you won't get that information in near real time. But if you are connected, you get a near real-time information. If the member provides a phone number, we get that information, and the phone number we might have in our record might be like a year old, but the information that we are getting in near real time. So we have seen some successes, and we haven't deeply looking into quantifying that, but we did see some successes into using that real time information to outreach to our patients and see what care do they need, and connecting them to the right resources.
Yeah. So what extra steps have to be taken when you're working with populations that in many cases are living unstable lives, meaning they don't have stable housing, they don't have stable food security, in many cases because they're in situations that aren't fully stable. For example, even getting their prescriptions filled can be a challenge on a day-to-day basis. As you try to care for them and try to note what their SDOH situations are, how are you managing that? Because that's kind of on the leading edge of what we're trying to do. Dr. Abad?
Yeah, so we're very grateful for our behavioral health teams, which are fully integrated into our primary care, but also, I'm working in the hospital right now and very integrated into our inpatient care and ER care as well. So, our social workers and medical caseworkers are really assisting with that. And, it's interesting you mentioned, I have seen a lot of patients just in this last week with a lot of unstable housing. And so we're very grateful when our behavioral health team members can, one, sometimes assess for mental health concerns and plug into resources, and sometimes assist more with things specifically around housing. It seems to just be the theme of the week is around housing.
Yeah,
And
absolutely.
so, yeah, and it's now we're kind of to a system where we can say, I think this person's eligible for housing for health. Do they have an application? Can we get that started? And we're doing much more proactively, at least when we have the patient in front of us, to be able to try to get that patient into a more stable housing situation, which we think will also contribute to better health. So that's one of the things that we're trying to do, but of course would love to step back and do that from a data perspective as well.
Yeah, absolutely. And I understand, just as a journalist, because I've spoken to wonderful experts like yourselves, there's this image in the general public. They have an idea of homeless as someone who is literally absolutely on the street. And in most cases, that's not the situation. In most cases, it's couch surfing, or someone is staying with their third cousin once removed for a week, and then they have to bounce somewhere else. So it's extremely challenging, because even keeping track of them can be challenging, and certainly caring for them and care managing them. Sai, do you have thoughts on that also, what Dr. Bob just said?
Yeah, I think this vulnerable population is something that we often talk about in a lot of strategic meetings internally. And we have a lot of departments, especially our case management department, behavioral health departments. So they work coordinatively with our community partners, in identifying these members if they need food or they need housing, and they go on a case by case basis. Them to the right resources, depending on their health. A lot of these people who are homeless, they have other chronic conditions as well, which further exacerbate the situation. So not only dealing with their mental health, we have to deal with their physical health and connecting them to the right resources. So we handle these things on a case by case basis, and we collaborate with the county partners closely to take care of this population.
Wonderful. I'd like to just give each of you the opportunity to take about a minute or two and share an advance that's happened in your organization recently that you just feel particularly proud of, that you feel happy about. We try not to be Debbie Downers, even talking about challenging situations. Dr. Abbott, would you like to just share something interesting and hopeful?
Yeah, I think that a lot of people will talk about the silver linings of COVID, and I think that it really forced us to move very quickly. And one of the areas where we advanced quite a bit on was around patient engagement. And so before, we had some mechanisms, but we weren't regularly sending out communications, and we also weren't getting patient feedback on that. But we have now a very robust system with our patient family advisory councils and hubs. We even have a virtual advisory council. And every time we're launching something, we're engaging with them. So we're about to do a big virtual healthcare push with integrated video visits and redoing the patient portal. And all of that goes through our patients. And then that actually comes out to communications for the entire population. So now we have a great new communications team that is regularly messaging patients when we have new programs, and also, to make sure they're maintaining their health and vaccines, all of that. And we just have this very robust system. We're texting patients. I feel like we're in this place where we're a lot more modern in our approach, and where I think there's been a true transformation in how we approach patients. And then the other thing that I think is really exciting is that we recognize that patients that are in vulnerable situations are looking for some assistance with digital tools. And so we have hired a group of health tech navigators or community health workers that are going to sit with patients in our clinics and get them comfortable with these tools so that they can really proactively engage in their care. So we're very excited. We're just about to launch that program, and very excited to serve our patients in that way.
That's wonderful. Thank you. Sai, would you like to just share one hopeful thing?
Definitely, we made a lot of progress, I would say, in last 2-3 years in some of the areas like interoperability, artificial intelligence, machine learning, and most importantly, health equity. We're hearing a lot about health equity, and it's really important when we talk about health equity. We want to make sure that we're not just providing care, we are also providing equitable care, and we made great strides at LA Care. We now have a health equity council, we have a health equity steering committee, and we have a chief of quality and health equity, and we are making sure that not only we're providing care for our members, but we're also taking other things into consideration. When we are delivering care to our members. And I think that's one of the proudest area, I would say. Great health information exchange, they're all great, but I think the health equity is one of the areas I think we're very proud of.
Wonderful. So I'll just ask each of you, what does the next 2 to 3 years look like as you evolve forward in this? Dr. Abad?
Yeah, I think, there are a lot of things kind of coming in the state of California. One is the CalAIM Medicaid waiver. One is the expansion of what was previously kind of restricted Medi-Cal and to full scope Medi-Cal for some patients over the age of 50. And so I think we're seeing our populations expand, and we really want our patients to be engaged and have, better quality of life and better quality of well-being and health. And so I think because we're leveraging a lot of tools to help us get there, I'm hoping that we can grow that even further and make the experience of, even if our patients are in vulnerable settings or situations, that there is dignity and respect in every time that someone picks up the phone and talks with them, in how we answer our patient portal messages. So as we get to this more kind of modern and current approach, I'm hoping that really lands with our patients, where we're providing that service level that really makes people feel heard and included and cared for. So we're moving in that direction with some of these tools, and we're just, I think, furthering our transformation.
Wonderful. Sai?
Especially for LA Care, one thing that we are working on, and I think it becomes very important in the next 2 to 3 years, interoperability with the new CMS interoperability rule, as well as the AB 133 that recently passed by Governor Newsom. It becomes important that we have a framework to collect the data in near real time, so that it helps us to provide necessary care to our patient at the right time for the right person. And again, we have the essential infrastructure through our health information ecosystem, and we are working closely with a lot of our partners in identifying the use cases and making sure that we leverage the data in health information ecosystems to drive quality for all of our members. And I think that becomes really important, because we are in a connected world, and technology plays a big role. And we want that data. In financial systems, when there's a bank transactions right away. Healthcare, you don't see that. And I think we are gradually shifting towards getting near real-time information, so that you can provide care at the right point.
That's terrific. Very last question. If each of you could leave our audience with a piece of advice as they advance along this journey toward better and more comprehensive population health management, leveraging data, what should they be doing? Dr. Abad?
That's a great question. I think it's really developing teams that are very robust and responsive to be able to deliver the data and analytics that are needed in a timely fashion. And I think that in itself is a big effort. And I think a lot of organizations struggle with that. And we are very grateful to, have some really talented folks that work with us at LA Health Services, and that have been very much leading in the way that we visualize data and are able to use that data. But we always need more of them. Like, we would love 100 more of them. And so building those teams, I think, is really key. That infrastructure is very key, because then that allows us, for those of us that do programs, to be able to use that meaningfully and use that quickly. So I think we're still working on the quick part of things. Every report takes longer to build than you might like it to. But when we do build it, it's just incredibly powerful what we're able to do with that. So I think building strong, capable teams that are, of the kind of highest level around data and analytics in these settings is key.
Wonderful. One piece of advice, Sai?
I would say sometimes too much data is bad. So we have a population of 2.2 million members, and we collect tons and tons of data, and and it's more important for us to not just have data, but identify what data is critical. How are we consuming that data? Is our case managers and the providers, jumping hoops, to access the data? That in that case, you won't get necessary buy-in from them, and you won't see the results that you see. So, making that data consumption seamless, and ensuring that we take that data and put in a centralized repository, and then improve user experience and make a lot of difference, and you get that buy-in from folks. I think that those are some of the areas that we have to critically look at.
Wonderful. Dr. Anshu Abad, Sai Vadela, thank you both so much for your expertise and your wisdom. And I know you're both incredibly busy, so we tremendously appreciate your participating with us today.
Thanks, Mark.
Thanks.
Thank you.
Absolutely. Thank you. So this concludes our session. And thank you to our audience for participating, and have a wonderful day, everyone.